Okay. All right, thank you very much. So just a shout out that we did have a meeting, committee of the whole, prior to our meeting, which was a closed session according to section 239 of the Municipal Act. So I'll call our regular board meeting to order, and I need an agenda approval. Reno and Ed, all in favor? Opposed, if any, that's carried. Thank you. And it gives me great pleasure to the board members and certainly to our viewing audience and to our media who are on board here. But I think you've already met with our acting medical officer of health. But I certainly want to take this opportunity to welcome him to our board and introduce to you Dr. Shankar Nezaturi, who is gracefully has accepted an interim role to help us through until we will find a permanent MOH. So I certainly want to take this opportunity to welcome you, Dr. Nezaturi, to Windsor-Essex and to our board, and looking forward to working with you over the next few weeks and dealing with obviously the daily requirements of public health, and especially under some difficult times with COVID. And we really appreciate you standing in for us and to offer your expertise and as a medical officer of health to lead us through in the next few weeks until we have a permanent MOH come forward. So welcome aboard.
Thank you. Am I able to share a few remarks now, Board
Absolutely.
Chair?
I was hoping you would.
Okay. Board Chair, Mr. McNamara, and members of the Board of Health, and my colleagues in my colleagues in the Public Health Service, and our guest today, thank you for this opportunity to speak to the Board of Health. I'm happy to share a few brief remarks and would be pleased to answer any questions. At the onset, I'm going to talk about the data, but one caveat I would note is that no one data element and no one event gives a fulsome understanding of the nature of COVID-19 or the nature of the current pandemic. Secondly, I am speaking contemporaneously, so if someone wants exact data, we can make sure that the epidemiology team gives that, provides that to members of the Board of Health. At the onset, the burden of COVID-19 to the people and the community of Windsor-Essex is probably as great now, or even greater than it was in the third wave of the pandemic, and that's evidenced by a number of factors, including the number of people identified with COVID on any given day, which is approximately 60, the number of people who are currently being treated, managed, or infected with COVID, which is around 400. The number of people, the percentage of people who test positive, meaning if you go for a test, what's the likelihood that you're going to test positive? It's around 9%, or 1 in 11 people who test or who go for a test now are testing positive for COVID. It's evidenced by the fact that we have perhaps two dozen cohorts of young people, classes of young people, and perhaps even more, who are being excluded from schools or from daycare centers, or in one particular instance, community colleges. It's evidenced by the fact that the number of outbreaks that we have at employers. So I think overall, the level of COVID burden to the community right now is quite substantive, and it's I think that as a strategic matter, we want to work on containment. And what does containment mean? Containment means that we want, as a community, as a culture, to make sure that the number of COVID cases in the broadest part of the community and the population is as small as possible. We want to make sure that if the COVID doesn't enter institutions, be they schools or religious institutions or workplaces, and if it enters an institution, that we can provide containment. That we can provide containment so that if it does enter a school, it's limited to as few people as possible and doesn't spread to other people at the institution. I also want to share with you from my own perspective, one of the key priorities of the public health service, and I think of the community overall, but I'll speak for myself personally, is to try to keep as best as we can, keep schools open as best as we can to focus on the instructional component of schools, and particularly important to make sure that elementary students get their instruction. I think if there's one deprivation that we can't take back, if I could use that metaphor, is the young people who've lost in-person education. From my own perspective, as a university professor, content-focused instruction can happen virtually. You can always teach calculus virtually. It's hard to provide socialization to a 6-year-old young person virtually. So I think that really has to be the focus, or at least one of the key focuses as we go through the pandemic. So what can we do? What can we do as a society, as a culture, as a community to try to control COVID-19 and try to manage the pandemic as best as we can? Well, first of all, it's a multimodal, multi-layered strategy. It's not one thing, but it's many things. And that includes physical distancing, staying 2 meters away from other people. It's wearing a mask indoors. It's wearing a mask when you can't reliably stay 2 meters away from somebody else. It's there's some other things that I think are particularly important. And that is that if you have children that are sick, keep them at home. Don't send them to school. If they have symptoms, keep them at home. If you're working in a factory or you work in a site of employment, if you're ill, stay at home. And I also think that we have to think of this as a real priority. We have 70,000 people in the health district who are eligible for vaccine who are not vaccinated. Vaccine is not a panacea, but it definitely reduces the burden of COVID to our community. And if I could highlight certain things, which is if you get vaccinated, you're less likely to get infected with COVID. If you get vaccinated and you get infected with COVID and you get sick, you're less likely to be admitted to the hospital with COVID. If you're vaccinated and you get COVID, you're less likely to die from COVID. Does vaccination prevent you from getting COVID in its entirety? No, but it does help reduce the risk quite substantially of getting COVID. And if you get it, you'll have a more mild course of the illness. That's what we know today. That's what we think is our understanding. The second item is that when one gets sick, when one gets COVID, if they go to the hospital, they crowd out other services that people might need. So the people who are, it's important to take care of all people, regardless of who they are. And if those people go to the hospital and they're still, and that uses hospital resources and physician resources and nursing resources, and that means that other services to people who need hospital and healthcare services are crowded out. And those people during this pandemic, when the hospitals have to stop doing elective, or I would really call them scheduled surgeries, or when you can't treat patients because there's no available resources, that's another reason to get vaccinated. So there's a reason to get vaccinated for yourself. There's a reason to get vaccinated to help the hospital system and others. And there's also a reason to get vaccinated because you're helping the broader community. People that are vaccinated are substantively less likely to get infected. I think my colleague from the epidemiology team quoted the number 1/6, I think. And if you can't, and my appeal as a doctor and as medical officer of health, as acting medical officer of health, is for those 70,000 people who are not vaccinated, please go get vaccinated. If you know someone who's not vaccinated, talk to them and ask them to get vaccinated. If they can't get vaccinated for their own benefit, which I think At least the evidence today suggests that that person who gets vaccinated will get benefit. Vaccinate yourself or help your children, or help your mom and dad, or help your wife or your husband or your boyfriend or girlfriend. Part of vaccination is about not just helping yourself, but helping somebody else. So in my mind, the dialogue with the unvaccinated is probably one of the most important public health priorities. If I could segue into my next major point, which is that public health is not just the province of the Public Health Service. Health is just not the province of doctors and nurses, it's the province of all of us. And the actions that each one of us take as community members will either can contribute to controlling the pandemic and achieving our goals as a community. I want to close with this. The Public Health Service makes judgments. Like everything else in medicine, we make judgments, and in many other professions, accounting and in the practice of law. But we have to work with the data that we have. Many times the data is inexact or imprecise, but we make our best judgments on the data. We modulate that assessment of the data based on our experience, and we use the best judgment that we can to formulate programming and plans. And that is what public health management is really focused on. We have an excellent team at the Windsor-Essex Health Service. I've been here for a few weeks, but they're an excellent team. They're on top of the material. And I think that working together, I think that we can do our very best to manage this pandemic. So Board Chair McNamara, thank you for allowing me to share my remarks, and I'm happy, if this is the proper process, to answer any questions.
Okay, thank you, Dr. Necessiteri. Any questions or comments to our MOH? Yes, Ed.
Thank you, Gary. I think what the doctor is saying, basically, it makes a lot of sense, not just to us, to everyone, including the public. Is any way what the doctor have even giving us in the last 10 minutes or so, is it possible to put it on our website or on the health unit website, or somehow let the people at least listen to it, let the people see how other people look at the vaccination and how important it is? Not just from listening to one individual, like what the doctor is saying now. It makes absolutely a lot of sense for people who have no idea that they are actually not just hurting themselves, but also they're hurting their families, their neighbors, because they are not getting the vaccination. Anyway, doctor, thank you so much.
Thank you. Board Chair McNamara, is it okay if I follow up on that comment?
Sure, absolutely.
So I think that's a wonderful message. And as members of the Board of Health, if you could use every method to disseminate the information and our perspective, I think that would be helpful. I think as a public health strategy also, we have to try to have dialogue with the people, not only the people who agree with us, but the people who might be on the fence or who have equipoise. It's okay to have equipoise, but the fact of the matter is in this particular case, vaccination is something that will help the broader community. And even if you have equipoise, put the equipoise aside for this and get vaccinated.
Absolutely. Robert?
Doctor, I just wanted to congratulate and thank you for an eloquent first address to us. I wish your words could be broadcasted nationally. Your approach is so important because you're looking at growing people's understanding is really the key to get the last mile done. And I'm glad that you expressed it the way you did. Just wanted to thank you for your efforts.
There's no question. In a marathon, it's always the last 2 kilometers are the hardest to finish. And there's absolutely. Any other further comments or questions directed to our medical officer of health? No, I sort of concur. I mean, we've got to keep driving the message. It's not about me, it's about us. And that's what we need to do. And it's to try to figure out how do we get the last 70,000 to move forward and get vaccinated. Because I know I've been criticized with I've said that it's now the fourth wave is becoming the pandemic of the unvaccinated, and the proof's in the pudding. Just look at our hospitals, and I keep trying to push that message forward. So thank you for your message. And hopefully the media who's on right now as well will have the opportunity to at the end of the meeting or at some point contact our MOH, but also put in print some of the message that's been relayed by our medical officer of health.
Great. Thank you so much.
All right. Any further questions or comments? Okay, I will go to announcement. Any conflict of interest on the agenda as presented to you today? Hear none. We've dealt with our committee of the whole under section 239. We have the updates from Dr. Nesaturi and on our update to, I believe, COVID-19, as you said before. I think that's relayed on a daily basis. Approval of the minutes of the regular board meeting of July 22nd, 2021. Joe and Fabio, any errors or omission on those minutes as presented? Hearing none, all in favor? Opposed, if any, that is carried. Thank you. Any business arising from those minutes? Okay, hearing none. Then I need a motion to receive the information reports on the consent agenda 9.11 and up to and including 9.14. Ed, Larry, all in favor? Opposed, if any of that is carried.
Gary, I did have one question. Sorry. On
Yeah.
9.11.
Yep. No, I was going to ask if there's anything that anybody wants to bring out of the report.
Oh, sorry.
No problem. Go ahead.
So I guess I'm just wondering if you could, if the staff could speak to again the targeting of vaccines to some of our lower income neighborhoods. I know that some of our postal codes show that some of the lower ones correlated to lower vaccine rates, and what we're doing about trying to some of that demo necessarily be an informed choice as to not getting a vaccine, but ability or wherewithal, ability to have somebody watch your children, take 2 buses to get there, etc. So I'm just wondering what we're looking at, because I know we have data that shows where some of the lower vaccinated rates are from and where some of the higher rates of infection are coming from.
Okay, Christy, I think maybe you can, she's on, and
I'm here.
okay, and maybe explain as well, is that the partnership that public health unit has with Transit Windsor, and if they can't come to us, we'll go to them. And that's what's been happening. So Christy, if you want to just maybe allude some of the programs that we have in place and partnerships.
Sure. Yeah, so we have a lot going on in terms of vaccine sort of administration around the community, and in particular working with our high priorities community group. So we have a lot of our grassroots community partners doing really local campaigns to clients, talking to them about the benefits of vaccine, trying to dispel some myths. As well, we're doing a really sort of hard-driven, data-driven strategy to provide vaccine opportunities. So we still do have our one mass vaccination center at Devonshire Mall at Sears, which is very centrally located. It's obviously on a bus route as well. It's pretty well attended. So we also still have all of our pharmacies providing vaccines. So you can essentially walk into one of over 120 pharmacies within our community at all varying areas. A number of them are also in high priority community postal codes. And then in addition, as Chair McNamara mentioned, we have a partnership right now with Transit Windsor, and we've been doing at least once or twice a week. We're calling it destination vaccination strategy, where the bus basically attends different high priority postal code areas, and essentially folks can walk right up, get vaccinated on the bus, do their observation time, and then they can head out. And so the bus does travel throughout the community. That's been pretty well attended. We're also continuing to do mobile clinics on a day-to-day basis. We've been working with workplaces. we've been setting up pop-up clinics. We're working with our CREST partners who also do a number of clinics on a week-to-week basis. So on any given day, we have 4 or 5 what we would call vaccination opportunities happening in addition to our mass clinics and our pharmacies, as well as still supporting vaccine distribution to our healthcare providers in our community. And there are well over 100 healthcare providers who are offering COVID vaccines to clients or on a walk-in basis as well.
Sorry, if I could just add, I just don't want to forget that we are working with the High Priority Communities Fund, which CMHA leads, and as Christy mentioned, that includes the CHC, the City Social Services, and CREST, as she mentioned, which is Erie Shores and EMS. And the whole purpose of that collaboration is specifically to target FSAs with lower vaccination rates.
Okay.
Great, thank you very
Fabio,
much.
okay, Fabio and Larry.
Thanks, Chair. I can personally attest to the good work that's being done in our priority neighborhoods, as I am a counselor in one of those priority neighborhoods, and we've had quite a few pop-up buses and clinics, and a lot of good response rate over time. Chair, I may have made a procedural error. I seconded the meeting minutes, and I looked at the minutes and noticed that I wasn't.
Oh, you weren't present.
Yeah.
Okay, then I will amend that, and we'll get
I'll motion.
Thank you. And it'll be seconded by Judy. Thank you for being observant. That's why we have a lawyer on the board. Larry.
Yes, thank you. Through the chair. Fabio already asked a question, but just to Christy, these pop-up clinics, okay, that we're having, how successful are they? Are they well attended, or just a little bit of feedback on that there?
Yeah, so I would say they have ranged greatly in terms of their day-to-day vaccination numbers. So we've had days as slow as 4 or 5, and then we've had days of upwards of 80 to 90 in a single day at the bus strategies. The mobile clinics and pop-ups, which are more sort of land ground, so they're tented or they're at different sites indoors, those tend to do about the same. We're really not seeing that sort of large hundreds of people coming to vaccination events any longer, but certainly for us, the day where we get 50 to 100 folks that come by is something that we consider highly successful at this point of the game.
Okay, thank you for the information.
All right, anything further? Yes, Dr. Nezateri, please. Oh, you're still muted. There we go.
If I have the opportunity to supplement my colleagues' comments and also share the concern I have with the Board of Health member, I think that one of our challenges is definitely not provide or trying to work towards improving access and availability. But I think the other substantive challenge is about building alliances with the people that we serve, because I think that there is probably, when one looks at the distribution of vaccine, with the health district and community partners and pharmacies have done, I think, a wonderful job with making the availability of vaccine. But there are, I think, communities or individuals in communities who either have a less of an affinity or less of an alliance with the health services, and somehow we have to reach out to those individuals to build that alliance. Certain communities have not always had a positive relationship with the medical community or as a group, not as individuals. So however we can reach out to people that have lower vaccination rates, I think it would be a priority for all vaccination, including COVID-19. The second point I'd make is a purely or substantively academic point. Infectious diseases or communicable diseases on average disproportionately affect the disadvantaged. And for COVID-19, if you live in a large home with 4 bathrooms, that's less likely to have transmission than if you have one family living in a 1,200 square foot home with 1 bathroom. And everyone still has to get ready to get onto their workday. So as we consider this, just not in COVID, but throughout, that we really have to think of how to reach out to people that don't necessarily have an affinity to public health services or we don't have the warmer relationship we could. I'm sorry for being long-winded on that, Mr.
Thank you, Dr. Nazateri. Thank you. Good points. Anything further on the consent agenda? Lori, you want to make a point on 9?
Yeah, I'd like to provide an update just on our approval. So if I could share my screen.
Absolutely.
And I'm hoping that all can see. And I apologize, I can't see hands right now. So if anybody's going to ask questions, if you could verbalize it, that'd be great.
All right, the
So,
only hand that I see up right now, Lori, is yours.
Okay, I'll take that down as all right. So our approval was received from the Ministry of Health in the latter part of July. This approval saw the health unit receive $17,684,500 in total base funding to support mandatory programs on a cost-shared basis, as well as our Ontario Seniors Dental Program and AMOH compensation initiative on a 100% basis. In addition, we received approval of $6.9 million in one-time funding. Firstly, in regards to our mitigation funding, as some of you may recall, last year we received multi-year funding for mitigation to mitigate the difference between the change in the funding from the Ministry of Health from what was 75-25 to now 70-30, effective the April 2019
Sorry.
budget approval. Yeah,
Chair,
sorry.
if I could just interrupt Lori, and I'm really sorry. I just noticed that Fabio put in the chat that he and Reno have to leave by 6, and we do have 2 resolutions, and I'm not sure if that'll affect quorum. So I wonder if we need to address those and then go back to the information.
Okay. Fair enough. Thank you.
Yep. Well, let's keep then, because of that, 912. We'll come back to that after we deal with the recommendations. Okay, so we'll move on to the recommendation reports. I think those are the ones, Nicole, you're referring to. 9.2-1, the consumption and treatment services. Eric?
Yes, thank you, Mr. Chair. This group will recall that we've been embarking on the process to establish a consumption and treatment services site, or a supervised injection site, safe consumption site, by other names, for quite a while now. And historically, we've gone through the process of conducting a feasibility study to determine the acceptance and feasibility within our community of establishing a site. Beyond that, there are multiple board information recommendation reports associated with that process. Beyond that, we issued RFQs and RFPs to landlords, building owners in our community to establish what potential locations exist in our community. Following that process, we were able to come to 2 potential sites. And those 2 potential sites are in the same sort of geographical areas in the N9A area code. And a resolution was brought forward to this board on June 16th that we move forward with a consultation with our community on those 2 specific sites to determine which of those 2 sites we would move forward with in our local, provincial, and federal approval process. And so I do have just some updates and a resolution to bring forward for endorsement from the board. And I'm just going to share my screen quickly, and I'll move through this because I have a couple of visuals that I want to get through. So the 2 sites were 101 Wyandotte Street East and 628 Goyo Street. 101 Wyandotte Street, essentially providing just a visual. It's on the corner of Wyandotte and Goyo. Nicole?
Sorry, it's black. The screen is black.
Oh, you have a black screen? Okay, it's showing up on my screen.
Yeah.
I can see it as well, Eric.
Yeah.
Okay, maybe it's just mine.
Okay.
We can see it.
Okay, I'll go back. Can I get a thumbs up, or can you see it now? Nicole, you can't see it.
Yep, I got it.
Okay. So 101 Wyandotte Street is on that corner of Goyo and Wyandotte, across from the McDonald's and across from the tunnel entrance. In the interest of time, I'll move through these quickly. The other is just, it actually shares an alley with that building. It's the building identified, or the unit identified as family furniture and bike shop on the bottom, on the lower end of this building at 628 Goyo. Between the two sites, you'll see slightly more square footage within 628 Goyo. Both are lease type agreements. There are 2 entrances at 628 Goyo and 3 at 101 Wyandotte. And there's a bit of a price difference between the 2, with 628 Goyo being a little more cost effective. The community consultation components, I'll move through these quickly. We had 448 responses to our community survey, over 100 within the N9A area code. We did virtual key informant interviews. 13 interviews were conducted with businesses and agency stakeholders within a defined radius of those 2 locations. We also did 7 focus groups with area stakeholder groups and business groups like the Downtown Windsor BIA. Following that, in order to target residents, in particular in that geographic area, we held 3 virtual town hall meetings with experts and administration from other CTS sites in the province, so that residents could have their questions answered. I'm going to move through these quickly. This is basically our data from that analysis. On the left, you'll see our full sample data, and on the right, you'll see the data from specifically our N9A area code. So when we look at levels of support for both sites, or one site or the other, you'll see on the left for a full sample, very similar results in terms of some degree of support for each site. 67% for 101 Wyandotte Street, 68 for 628 Goyo. So just that small increase for 628. On the right, you'll see within the N9A area code a bit of a difference where you'll see 66% provided support or indicated support for 628 Goyo and 63% for 101 Wyandotte Street in the surrounding area. Again, when you look at the survey responses, we asked very explicitly, which one would you prefer? The large bar graph in the middle, the teal type color, is support for either site. And then when you look at 628 Goyo in that orange bar, you have 19% relative to 13% for 101 Wyandotte Street East. That's the total sample. And then in looking at the N9A area code, you do see an even bigger difference between the preference being 22% for 628 and 13% for 101 Wyandotte. Key informant interviews slightly edged towards 628 Goyo by a factor of 1 interview. But when you look at the focus groups, you see 5 of the 7 focus groups reached a consensus or a majority agreement that 628 Goyo Street was the preferred location, and 2 did not reach a consensus, but none of them indicated 101 Wyandotte. So proposed directions going forward, we did bring this information to our CTS Stakeholder Advisory Committee. And they did endorse a recommendation from us to move forward with 628 Goyo. And today we're asking that the board support that endorsement as well.
Is it extra on top of what we have?
I'm sorry?
Reno?
Thank you, Gary. I'm prepared to make the motion to move the recommendation, and I just wanted to applaud the efforts. I've been involved. I sat in on some of those stakeholder groups and some of those focus group sessions, and I think the public consultation on this has been stellar, and I think it's something that we should be proud of, and I'm just eager to see this move forward. So I'll be willing to make the motion to move this forward.
All right, thank you, Reno. I do have support on the motion. Ed? Any further questions or comments on the recommendation? Hearing none, all in favor? Opposed, if any? That is carried. Signing authority?
So it's just we need a resolution to formally remove Dr. Ahmed's signing authority.
Yeah, and it's basically the proposed motion is whereas the Board of Health accept Dr. Ahmed's resignation as Medical Officer of Health for the Windsor-Essex County Health Unit effective September 12th, 2021, that any signing authority that Dr. Ahmed has under the organization be revoked. Now therefore be it resolved that Dr. Ahmed's signing authority for the Windsor-Essex County Health Unit be revoked effective September 12th, 2021. Judy, Reno, moves, seconded. All in favor? Opposed? That is carried. All right. I don't think there's any other items.
I just don't know in the last few minutes, there's the audit, the membership.
Yeah.
for the audit.
Yeah, 10.1. Need to deal with that under new business. Nicole and Lori.
I'll turn it over to Lori.
So in regards to the audit committee presently, Tracy Bailey is the only sitting member of the board that is on the audit committee. The audit committee has historically had 3 individuals on it. What we're looking to do is have the board nominate another person to sit on the audit committee. And we're also looking to take that 3rd position and put out an application process similar to what some of our other public sector partners have done, to go out publicly for another sitting audit committee member. So I think we were hoping today to get a nomination or to discuss that with yourselves for the 1 member. The second part of this, Nicole, I don't know if you want me to speak to the project governance as well. We were also looking to reconvene the project governance committee, looking for representation from city, county, and provincial, and also at perhaps not at this particular moment, but at some future date in the very near future, having an application process as well to engage a stakeholder within our community to be a part of that project governance committee.
Okay, so nominations, then that could be dealt with. You want to do that like our October meeting? Or do you want somebody on board now? So just give some opportunities, for especially those who are absent or need to leave.
Okay, we can do that for the October meeting then.
Yeah. Yeah, and in terms of an outside board interest in that maybe you can I would recommend to the board that you reach out and into the community, obviously, and to see the interest of bringing a independent. I'm going to call them independent.
Yeah, and so we could bring forward, we would recommend that application process. We could bring it forward. We have reached out to the school board, among others, who have a similar type of process,
Yep.
and we could bring that forward.
Yep. No, and I no need to wait on that one. It's just on the internal. I would say go out and start reaching out, and we can hopefully once been vetted and can be then presented to the board in the October meeting.
Certainly.
Same time.
Thank you.
Are we okay with that, members of the board? All right. So then just a motion then to concur with the recommendation brought forward by Lori and certainly Nicole. Larry and Fabio, all in favor? Opposed? Carried. And Nicole, you might as well. We're on a roll here. So the GEM extension.
Yeah, so this is, the board had approved GEM. So this is a group that we've used for our case and contact management. That contract is about to end, but given where our case counts are and our ongoing recruitment, we would like to, we plan to engage to extend their contract further, and we just wanted to let the board know that we would be doing so.
Yes, I certainly would recommend that, and in particular what's transpiring right now. So the pleasure, moved by Joe, and do I support Judy? and that we extend the gym extension.
We all thank you for that.
Yes, I know, I'm sure. All in favor? Opposed, if any, that's carried. Thank you. I believe now we could go back to Lori, and thank you, Fabio, and who else has to leave? Okay, Reno. Well, thank you. Okay. Go ahead, Lori.
Okay, so I'm just going to start back from where I left off. So in regards to one-time funding approvals or combined one-time funding approvals were $6.9 million for calendar year 2021, and then going further to March 31st, 2022. I'll highlight the mitigation funding, which is the multi-year funding to help bridge the gap between the 75-25 change to 70-20 that was enacted with the April 2019 budget. Additionally, we were successful in receiving one-time funds to support extraordinary costs associated with COVID of $880,000 and COVID vaccine of $2,937,000. I would like to highlight in regards to the COVID extraordinary, the $880,000 that was granted to us represents 24% of what the ask was in relation to COVID response. And the vaccine approval represents 50% of what was asked for. The ministry did so on the basis that they were trying to assist health units that were experiencing cash flow problems, and they were attempting to accelerate approvals. That being said, this does not preclude us from accessing additional funding in the remainder of 2021 to further support those initiatives in the event that we expend dollars above and beyond what was approved. Lastly, the school nurses initiative, as again, some may recall from last year, we were granted funds for 19 nurses to support the schools in reopening and responding to COVID. That approval is continued until until July of, I'm going to scroll down, until July of 2022. We've got 1.9 million that goes to March of 2022, and then additional 627,000 to bridge us till the close of the school year, July 31st of 2022. And then lastly, and this is something that ties to actually something in the correspondence package, and Chair McNamara would be aware, an appeal was made by public health units, our public health unit, as well as a number of others, to the Ministry of Health regarding the mitigation funding. A lot of health units expressed concern going into 2022, and in particular the budgeting process and having to deal with the full force of the change in funding approvals in the 2019 budget. And we received communication as well that the mitigation funding will be continued for one more year in 2022.
Okay, any questions or comments to Lori? All right. Then that was dealt with under consent agenda, just on the report. So thank you, Lori. And so now we can go down to correspondence. Motion to receive all correspondence. Oh, I don't believe we have quorum anyway, at this stage here, but we're just looking for receipt. And so I believe at this stage here, there's no further business. Our next meeting, members of the board, is October 21st via video. And if there's no further questions or comments, then adjournment is in order. So Judy and Joe, all in favor? Opposed, if any, that is carried. Thank you, members of the board, for your indulgence today, and also administration. And with our business coming to an end, I certainly want to accept my best wishes for the rest of the evening, and for those who are streaming, they're out there, get vaccinated, and certainly stay safe. So with that, I bid you all good afternoon, and till we meet again. Thank you.